Squamous cell carcinoma of the tongue. Case: a 73-year-old man presents with a 1-year history of a persistent ulcer and white patch on the right margin of the tongue and soreness while eating. She did not smoke or drink alcohol. External examination found no cervical lymphadenopathy. Internal examinations reveal a well-circumscribed superficial ulcer with a homogeneous base and intimate upper border, and an adjacent speckled red and white patch at the lower border. Incisional biopsy of the intermediate upper border revealed invasive squamous cell carcinoma. Definition: oral cancer refers to cancer occurring between the supermammalian border of the lips and the junction of the hard and soft palates or the posterior one-third of the tongue. This may also result from any chronic irritation such as dental caries, overgrowth of mouthwarts, chewing tobacco, or the use of fetal food. Oral human papillomavirus (HPV), typically occur via oral genital contact, may have a role in the etiology of some oral cancers. However, the role of HPV is not as clear definitely in oral cancer as it is in oral pharyngeal cancer.
Okay, this looks to me like kind of a grisly picture of a big tumor. You can recognize this as being the tongue, at least the oral part of the tongue. When you get to the back part of the tongue, the posterior third, which is the pharyngeal tongue, you could see up here the epiglottis, or at least part of it, and then you can see a large tumor mass growing in a fashion which looks like diffusely infiltrative. You can see some black areas, perhaps old hemorrhage. You can see that it's a very non-homogeneous uncut section. You can also see down here, this appears to be the opened portion of the larynx and trachea as well from posteriorly. I'm guessing that is. Let's take a look at this tumor of the posterior part of the tongue microscopically. Here it is. You can recognize quickly that there appears to be in this area at least a mucosa which is intact and overlying part of the tumor that is infiltrating deeply throughout the tongue here. Here is a part of the mucosa that is perhaps ulcerated, thickened, and solid tumor. But in this area here, you have a little rim of overlying normal mucosa, and I think you might be able to recognize these areas, this area, as perhaps having a lot of secondary inflammation as well. This is primarily a chronic and organizing inflammation. Here's a residual portion of what may be normal overlying epithelium, or perhaps it's not normal. Let me take a better look. It could be normal, but it is certainly overlying these big nests of cells here, which have pearls, look clearly squamous, haphazardly infiltrate the underlying connective tissue. And because this is the tongue, if we go deep enough, we may see that some of the tissue that these little nests infiltrate is indeed a skeletal muscle. These are skeletal muscle fibers here, which are in close proximity to this invading group of tumor cells, and that's why they are degenerated. All of these blue areas here are tumor, here, 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 here. And notice how they are engulfing these degenerating skeletal muscle fibers. You're not likely to see striations on these cells anymore. Here is a larger cluster of tumor cells. And once again, they are forming pearls, so they are very, very easily being recognized as squamous cell carcinoma. Thank you very much.
Applications in medicine. Symptoms and signs. Oral lesions are asymptomatic initially, highlighting the need for oral screening. Most dental professionals carefully examine the oral cavity and oropharynx during routine cleaning, and may do a brush biopsy of abnormal areas. The lesions may appear as areas of erythroplakia and leukoplakia, and may be ectophytic or ulcerate. Cancers are often indurate, appear with a rolled body, as the lesions increase in signs, pain, dysarthria, and dysphagia may result.
Top 10 mouth cancer symptoms. Cancer is defined as tumor resulting from an uncontrolled division of cells that enters and cause damage to our body cells' tissues. Oral cancer is where a tumor develops on the surface of the tongue, mouth, lips, or gum and it does not go away. Tumors can also occur in the salivary glands, tonsils, and the part of the throat from your mouth to your windpipe, but these are less common, and they become dangerous if they were not treated at early stage. What are the symptoms of oral cancer? The common and easily identifiable symptoms include: Number 1. Inside the mouth area, either on lips and gums, there will be some kind of swelling, lumps, rough red spots. Number 2. White and red soft covering grows inside the mouth. Number 3. Mysterious blood flow in mouth area. Number 4. Inexplicable emotions, feelings lost, continuous pain in mouth or neck area. Number 5. Alternate spots on mouth, face, and neck that flow blood easily and cannot heal easily within 14 days. Number 6. Person feels that something get jammed in the back of throat. Number 7. Person feels much pain and difficulty in speaking, eating, or moving the jaws and tongue. Number 8. Harshness, sore throat, ear pain, and changing of voice is also a symptom of this disease. Number 9. Fastest weight loss. Number 10. Change in the pattern of fitting of teeth. If you notice any of these symptoms happening, immediately visit to your dentist or any professional healthcare. Thank you.
surgery with both operative radiation or chemoradiation as needed. For most oral cavity cancer, surgery is the initial treatment of choice. Radiation or chemoradiation is added postoperatively if disease is more advanced or has high-risk features. Pros and cons. The possible complications the squamous cell carcinoma of tongues could be severe discomfort while eating, chewing, or swallowing food. This can even lead to weight loss. A partial or complete loss of this sensation. They can metastasize to the lymph nodes, tumors that invade into nerve, tumors that are over 2 centimeters in size have a higher incidence of recurrence of metastasis, severe emotion and psychological stress. Issue in Ecuador. In Ecuador, there is a high incidence of oral cancer due to risk factors such as drinking and smoking. The population have available free checkups in health centers published, but the unknowns of this disease await the population of a rapid diagnosis. They have implemented many preventive campaigns against oral cancer to inform the population. Conclusion. In conclusion, oral cancer can be a deadly disease if not diagnosed early. The risk factors increase the occurrence of it, and a rapid diagnosis will help better control symptoms.